great pleasure to offer welcome to Professor Lucy Chappell. Welcome, Lucy. So Lucy is Chief Scientific Advisor to the Department of Health and Social Care, and of course is Chief Executive of the National Institute of Health and Social Care Research. She's also Professor of Obstetrics at King's College London for her day job, and as well as other hats that she wears. So Lucy, you're very welcome, and I think Lucy's going to tell us a little bit about the NIHR vision and priorities for research funding, particularly around public health and health improvement. So thank you, Lucy, and over to you.
Well, thank you very much, Ashley, and thank you for the opportunity to be here today. Working from home, given the rail strikes, but always, I think there's the bonuses of being virtual is that it often can be much more inclusive, and I'm sure that that's been true for your meeting. And I'm also aware that you've got Chris Whitty and Janelle DeGrucci joining you, I think, and so I'm going to focus on some of the NIHR aspects. I would really love this to be interactive and to get some questions. So I'm going to try and keep what I'm presenting quite short and then really take an opportunity to address questions from this community. So let me just share my screen. This is where I hope that you're not necessarily going to see my emails. Give me a moment. How does that look? Hopefully that's all good. So I'm just going to reflect on a few things around where SPHR is going as you head into your next quinquennium, and really reflecting the very positive breadth of geography that is being incorporated into your members. And this is important because we've been very clear about the levelling up agenda and how, whilst this might on one hand look like a political slogan, it isn't for us. In NIHR and I'm sure in SPHR, it is something that we need to live and breathe because it matters so much to public health. And if we didn't think about the levelling up agenda in public health, we would have missed the point entirely. So I think this geographical representation looks really positive. And also, I'm quite sure that your ambitions are not to stop at just here, but to go further and to really think about how you continue that reach over and above your centres. In terms of the planning, this is what I understand you're working on. And I just want to sort of reflect on why this is so important from the NIHR's perspective. And if I go on the right to the strategic focuses, what I really like about the research programme is the intersection with the strategic focuses that we have set out in Best Research for Best Health, the next chapter, which is a one-year-old now. And really we're looking to how those strategic focuses are delivered through the research that you're proposing. So very much about how we come out of this phase of the pandemic. We don't quite know where we're heading. We're going to have other emerging infectious diseases, but thinking about how we use that recovery and reset to really address some of the health disparities that were very obvious. We are very clear about our ambition to build capacity and capability in preventative and public health, which is a topic close to all of you, but also this focus on social care research. If I think of where we can make gains and really incremental step changes, it is going to be in those areas. There is plenty to do in health research. It's not that I'm saying that that will be put to one side, quite the opposite. It is time for health researchers across all areas to think about the population health and social care implications of what they do. And when I've been out and about in the last year, and I might go and talk, I was talking at UK Kidney Week a couple of weeks ago, and I challenged them to think about the public health and the population health aspects of kidney well-being, and it got some conversations going. Clearly, those with people with multiple long-term conditions are something that you will all be considering, and there's a couple of aspects of that. Thinking about the range of conditions, including mental health, and really how we see how we address the challenges of mental health, but also see an integration with physical health, and for many people, they are very integrated and very interdependent. And so it's really welcome to see how you're putting that as a focus. I think this other aspect on ensuring that we reach underserved regions and major health needs, and really thinking about that through the health inequalities lens. So ensuring that we don't just do research where it's easy, that none of us come out with research projects where we've got a very high preponderance of one group to the exclusion of others. So I look at the NIHR Journals Library fairly regularly to pull out examples. And sometimes I might go to a topic area and I'll choose something a little bit at random, and I'll see that slightly disappointingly, the participants were 95% white male when that didn't reflect the underlying disease. And then I'll go to another study in the same area, and I'll see that the research team, the investigators, have worked hard to ensure that their population are truly representative of the wider group that they are seeking to serve. So I think this framing of how do we all ask ourselves, are we really reaching the population that most need this? And I'm sure that's something that SPHR is very used to doing and is woven in through all of you. We do want to see ED&I, and my view is that ED&I is a virtuous circle between researchers and research participants, and that is how we will continue to drive it. And that is also paired with how we look at careers for research delivery staff, but also underrepresented disciplines. So the wealth of disciplines across SPHR is very welcome. And I would ask that everyone goes out to recruit a friend who, again, may not be so familiar with the NIHR, but where you know that that could be a part of what they do in their life. And equally, a more challenging conversation about working with the life sciences industry. The public health researcher community have embraced these in a number of ways, and I think have been the first to recognise the challenges in this area, but doing it in an open and transparent way, led by people in public health research, is really welcome. So I really see the overlap between your research priorities and where we are in NIHR. And I think these principles of working, again, shown on the slide in the middle, but also thinking about our operating principles of impact, excellence, inclusion, collaboration, and effectiveness are very strongly mirrored. You'll be aware of how we are trying to move in public health. So this is the NIHR Health Determinants Research Collaboration, where we were overwhelmed with interest and application, such that we are going to be running this competition again before too long, because we really recognise that many people in the community stepped up to recognise this as an important topic and show the join up, particularly with local government. So to new ways of working that we really wanted to see embedding very much beyond the usual sort of secondary care sectors. So we very much hope that this is the first of many such collaborations, and that we can be a part of funding that. I'd also like to touch on the three schools work, because for me, I get to see, I get to approve funding requests, and I am absolutely heartened by the three schools work. I think it is completely at what we are looking for, to join up across our traditional silos. And I'm sure that many of you could have really thriving collaborations across this. It very much speaks to what I think is important, which is the joining up piece. And that might be at a person level. We know that the NIHR Academy is supporting a wider range of health and care professionals, and those from a variety of backgrounds than ever before, and we always want to see how we can go further. We know that's important in terms of place, so reaching out geographically, and I see SPHR doing that. And also in terms of project, and thinking about what those collaborations look like, and that if we're going to solve the complex problems, we need to get people in the room who might not have conventionally been represented, but are going to be part of the solution. So I see that across SPHR, and very much commend that to you going forward. So that's a very brief sort of whistle stop, because I would really like to think about how we like to hear from you about how we might tackle that, and I'm very happy to take questions on that, Ashley.
Thank you very much, Lucy, and thank you very much for all you've covered. I think a couple of just reflections there in terms of, you talked about capacity and capability and recruit a friend. One of the aspects that which you'll be including in the next 5 years is an opportunity for some transdisciplinary placements and then fellowships, and we're really excited about that. And we will be looking for help to make sure the adverts for that get to the right places and beyond the usual public health networks and so forth. I think in terms of underserved,
and sorry, Ashley, just to say, my view is that research is for all. And research is everyone's business. And in SPHR, you're the converted, and there's an opportunity to go and show others the power of what you're doing, and to find those and say, yeah, this is anyone can start on that journey. So really, that's I think you've got to reach into areas that would be really exciting to see more from those areas.
And I think we believe there's lots of people doing work that's relevant to public health and contributes to public health, but don't see themselves as being involved in public health. So it's getting that narrative and trying to attract those people to come and work together in partnership, not to leave their discipline, but to work together. So that will be an opportunity. I think you mentioned about underserved regions and communities, and I think this is something that we've been working very hard to do, and I've seen some examples of that, and particularly including the voices of the public from different communities. So we've had some really good examples of presentations from that. I think the other is in terms of EDI, and this is something that we've been doing some work on, but need to do much more on across this 5 years, and we'll be doing that. I've got one question here for you in terms of the FES scheme, which you might have just heard some presentations on, and maybe some reflections on that. And obviously, NIHR has now commissioned FIRST and 14s, and now some more. What do you think we should be doing in terms of our FES scheme so we don't duplicate FIRST?
Well, thank you, Susan, for that question. I mean, I think I'm going to slightly turn that back, in that I think you are the experts, and I think I've learnt to respect the experts in their field as knowing probably far more than I do about the opportunities and the challenges. It's fair to say that NIHR is what I politely call a multi-headed hydra, and that it is really good if we keep on inventing schemes, but we must also think about how we make it easy to navigate and easy to understand what we're doing. Mm-hmm. So I would say SPHR is actually in the best place to say, where are you seeing gaps that do need to be filled, and where we should be building capacity or building opportunities and projects, or whichever way it might be, but how do we harmonize that and make it easy to navigate? So rather than do a sort of top down, I'm going to tell you how it is, I think that this community needs to work that out. And then I'm almost, what I want to communicate is to give this community permission to do what's best for them, and to own it themselves, because I think that the expertise lies in the group here, not in me, in a good way. I can take decisions, but I would much rather hear from those who are at the coalface or at an SPHR level, to say, this is working, but this was too much overlap. Ashley, is that a fair way to respond?
It is, absolutely, and I think we've been thinking this through, and one option would be to not to do FES again, but excuse me, the value that it's brought, I think, is seen in the evolution of the FIRST. So our thought is that the gap for FIRST is actually with the third sector, voluntary sector organisations, and that might be something where we can focus to build capacity and partnership, and extend our partnership in that way. So I think that probably will be the direction that we will be heading on that. And within some of that, they will be opportunities for placements for PhD students and our fellows, both working in local authorities but also within charities and voluntary sector, because that means that we get people with insights in how it works out there,
Yeah.
that they can build into their research.
And that bridge building activity is crucial, and I think it's also very much the essential part of addressing the health disparities. If we don't build those bridges, we'll carry on serving a much narrower part of society, and actually what we want to do is to reach all.
Thank you, and we're all on tenterhooks waiting for the health disparities white paper. So
Indeed.
yeah, I think
Yes.
we talked about that a little earlier today,
Yeah.
and we're looking forward to that and looking at how we can
So I
respond.
think it's a real opportunity. I think it will be coming out reasonably soon, and I think it's going to be, when you start with the white paper, it's what we all do with it that's going to count. And the fact that we've got one matched with the levelling up, matched with the other smoking reviews and other areas, tells us that we should capitalise on every call to arms to the public health community to shift on this. And so this is a time for growth that we must lean into.
Thank you, Lucy. And I think we've got more on our program going forward tomorrow. But I know that you're on a bit of a schedule here. So I think what I would like to do is, first of all, just mention you highlighted the 3 school work, and that really has been an opportunity. We've got people through our school as fellows coming off some of our fellowship programs, and also being able to work with primary care and with social care across that piece. So I know we've just got a little bit further funding in dementia, which is just announced last night, so people won't necessarily have heard that just yet, but we'll be sharing that news later, and that's exciting.
And when I reviewed those, it absolutely filled me with hope and joy that join up was happening in a way that actually I think you're ahead of the game on this. Those connections that perhaps for those from sort of more conventional secondary care specialties, I think you are definitely ahead and can capitalise on that. It very much more reflects both a patient journey or a member of the public's journey, and also the changing demographics. So we are seeing people live with more multiple long-term conditions, and if we carry on just addressing them in a siloed way, we're not going to solve those challenges. So I think seeing that join up and thinking about both how you do that join up in a number of ways is really welcome.
Thank you, Lucy. I think finishing on a note of being ahead of the game, not being complacent, and maintaining being ahead of the game is a good place to close.
Lovely. So one other thing, Ashley, I am aware that sometimes there are challenges. I'm making it sound all and I know the great work that SPHR is doing. So there are things like excess treatment costs or in a different concept. I am always happy to hear back as to when we move into new areas, what becomes the sticking points, and so all sorts of things I may get asked about. Are your schemes open to this group? And we constantly review that and try and evolve our schemes so that we are inclusive. And the public health research community is a really good area where we need to constantly update what we are offering to make it inclusive. So if people have got ideas about where there are sticking points, funnel them through Ashley or the school so that we address them. And ditto with Brian Ferguson, who again is very much all of us are working to try and smooth out those bumps in the road, so that we can do the research that we want to do, and that the research that matters.
Okay, thank you, Lucy. It's good to know that you're there to listen to, and we'll make sure we can coordinate that and feed those to you. And I know things are changing in a positive way, but challenges do remain.
Exactly.
Yeah. Okay. Well, thank you all. Thank you very much, Lucy, and thank you all